one of the most successful programs in the American Heart Association over the last decade or so have been their Get With the Guidelines programs. These are programs to certify excellence in hospital care for a variety of different diseases, including stroke, acute heart attacks, congestive heart failure, and so forth. Our program at Wyoming Medical Center has been participating in Get With the Guidelines for the past 7 years. From the very beginning, we achieved our bronze medal in our first year, our silver medal the second year, gold medal the third year, and in the 3 years since then, we've been awarded the Gold Plus, or highest award level from the American Heart Association for excellence in stroke care. This year, we also achieved a secondary honor called the Target Stroke Honor Roll, which recognizes our ability to reliably treat stroke patients in less than 60 minutes after they arrive to the emergency room. So in other words, door to needle time, less than 60 minutes most of the time, is the new standard of care, and we have demonstrated our ability to meet that standard for the past year. The Gold Plus Award and our participation in Get With the Guidelines, as well as our certification by the Joint Commission as a primary stroke center, are all indicators to our patients and to the public that we have taken all of the appropriate steps to become a center of excellence for stroke care. So patients and their family members can be confident that their loved one will receive absolutely the best available stroke care every single day, 24 hours a day at our hospital, and I'm very, very proud of that fact. Patients and family members are uniquely sensitive to taking in and using new information in moments of crisis. And so when somebody is sick in the hospital, that's when their mind and their ears are wide open to new ideas about how to avoid becoming sick in the future. So one of the things that Get With the Guidelines program did right from the beginning is evaluate how well interventions worked in hospitals that use Get With the Guidelines. And so, for example, if patients were told in the hospital that one way they could avoid having a stroke in the future is to take medicines to lower their cholesterol, these patients were more likely to stay on their cholesterol-lowering medicines 6 months down the road than patients who were not told while in the hospital that they should be on those medicines. In other words, by using a teachable moment, that moment of crisis in the hospital, you're much more likely to achieve long-term success for the patients. And that's really the beauty of programs like Get With the Guidelines. We not only do we use the cutting-edge standards of care in terms of treatment, but also teaching and education, and there's very clear evidence that it has dramatic benefits in terms of improving outcomes for these patients.